My name is Nathan Brown. I'm one of the physical therapists here at Point Forward Physical Therapy, and today I want to talk with you all about vertigo. Vertigo is a term that a lot of us are familiar with or have experienced, and it's used to describe the sensation of spinning or that the room is spinning around you. And even though it's a really familiar term, I think it's also very misunderstood. So the big first drive home point that I want to make is that vertigo is a symptom, it's not a diagnosis. So similar to the reality that if we had knee pain, we'd want to know what's causing our knee pain. Is it arthritis? Is there a tendinopathy? Do we have some issues with our meniscus? In the same way, we should be asking that question about vertigo. Why am I feeling like I'm spinning? What is the root cause? So if we look from a big perspective, it's typically something that's either central, meaning it's originating in the brain, or it's something peripheral, meaning that it's happening in our vestibular system. So our vestibular system is extremely important, but sometimes overlooked, or we don't know a lot about it. And really what it does is it helps us have body awareness of where our head is in space, whether with tilting side to side or rotating. And then it's also responsible for keeping our eyes fixed on objects as we're moving our head. So our vestibular system does a lot for us to keep us steady and on our feet and keep us from having that symptom of vertigo or dizziness. So when it comes to what do we do about if I'm having vertigo, the first step is to figure out what's causing it. And so as a physical therapist, I love to work with people who have symptoms of vertigo. And one of my jobs and one of the things that I'm trained in is to figure out what's the cause. And there are a few causes that are some of the more prevalent reasons that people experience vertigo that can be treated with physical therapy. So two of those include benign paroxysmal positional vertigo, or BPPV, and the second is vestibular hypofunction, which ends up feeling more like unsteadiness more than the actual vertigo dizziness. But there are a lot of exercises and techniques that we use here in our clinic that help people decrease their symptoms of vertigo or eliminate them completely. So if you're experiencing vertigo, I really encourage you to start to figure out what's really the root cause of this problem so that you can get the right treatment. So if you have any other questions about vertigo or would like to learn more, feel free to call our clinic, or if you're experiencing vertigo, I would love to work with you and help get you less dizzy and more comfortable on your feet.